What happens during cochlear implant surgery? In this video, we'll teach you what really happens during cochlear implant surgery without reading too many print materials or without joining too many Facebook groups. Many patients feel anxious when they hear the word surgery, but cochlear implant surgery is actually one of the most standardized and well-established procedures in modern hearing rehabilitation. A cochlear implant procedure is designed to place a small electronic device under the skin behind the ear and insert a thin electrode array gently into the cochlea. The goal is to allow electrical signals to reach the auditory nerve when the inner ear hair cells can no longer transmit sound properly. During the operation, the surgeon creates a small incision behind the ear. A receiver implant is secured in the bone, and a very delicate electrode array is carefully inserted into the cochlea. This electrode array will later deliver electrical stimulation corresponding to the different sound frequencies. Clinically, surgeons aim for atraumatic insertion to preserve cochlear structures as much as possible. Modern electrode designs, especially flexible arrays, help reduce trauma and maintain the delicate anatomy of the inner ear. For many patients, the biggest concern is safety and recovery time. In reality, cochlear implant surgery usually takes around 2 to 3 hours. Most patients go home with 1 or 2 days depending on hospital protocols. Compared to many other medical procedures, recovery after cochlear implant surgery is relatively fast. Because cochlear implantation is both a medical and financial commitment, patients often spend years considering whether the surgery is worth it. During this time, many continue upgrading hearing aids hoping for improvement. Unfortunately, delaying intervention can reduce auditory brain stimulation, making rehabilitation longer later on. Think of the brain like a muscle. When it receives regular stimulation, it remains active and responsive. When sound input is reduced for many years, the auditory pathways become less efficient. Cochlear implantation restores that signal, allowing the brain to start listening again. In Asia, families hesitate because surgery can feel intimidating or financially significant. However, understanding the procedure helps patients make informed decisions and plan early. Early intervention often leads to better speech understanding, easier rehabilitation, and improved quality of life. Cochlear implant surgery is not about restoring perfect hearing overnight. It is about restoring access to sound signals so that the brain can relearn how to listen. With proper programming, therapy, and consistent device use, patients regain the ability to understand speech, communicate confidently, and reconnect with everyday life. If you like today's content, book your appointment for consultation and learn if cochlear implants are the right solution for your hearing condition. Please visit our website www.hearlife.com.sg for more details.